handheld dynamometers are so good and versatile, why do all these hospitals and research laboratories invest lakhs of rupees in isokinetic dynamometers? See, handheld dynamometers and isokinetic dynamometers aren't really competing with each other because they're answering very different clinical questions altogether. A handheld dynamometer, when put inside a belt and stabilized, basically becomes a belt stabilized dynamometer. The advantages of this setup is that first, the examiner does not have to give any counter force. Second, it produces a lot more repeatable and consistent data measurements. And third, if you have a sports person or a patient who's stronger than you don't have to give the counter force. So naturally, the belt stabilized dynamometer is used, sports setup in MSK clinics where you see a lot of gym patients and a lot of return to play decision making. The isokinetic dynamometer is not really measuring the force produced in one single push. It is a controlled movement across a range of motion where the clinician is assessing a lot more than just strength. They are looking at the peak torque, the power, the work done by the joint, fatigue, performance, so on and so forth. Clinical research consistently shows that isokinetic dynamometers remain the laboratory reference standard. However, because handheld dynamometers are portable, affordable, and very easy and quick to set up, they don't eat up a lot of our clinical time. They're a lot more practical. The clinical takeaway here is that isokinetic dynamometers are the laboratory reference, but all you need is one simple tool to make excellent clinical decisions.